Congratulations, you've just been told you're pregnant. So, this talk is particularly for first time pregnant ladies. So, we're going to be talking about those perceivable changes that occur during pregnancy. Now, I mentioned earlier, this talk is particularly geared towards the first time pregnant person. However, anyone can benefit, including the non first time of pregnancy. Now, for the non first time of pregnancy, they're pretty much already set expectations, having been through that route. For the first timer, on the other hand, it's a mixture of varied feelings from anxiety, excitement, pretty much an emotional roller coaster, especially as the days, the weeks, and months proceed. I'll talk about my experience, well, briefly, when I was pregnant. I was approaching an age that was considered high risk, and so having been through a formal education that exposed me to various presentations of SIS, that is pregnancy, there were certain experiences I was anticipating, but the actual experience was somewhat different. Now, every experience is unique, every individual is unique. However, there are certain changes that are common and should be anticipated. For full term pregnancy, this is a gestation age at 39 weeks to 40 weeks. Um, in the past, it was said to be 37 weeks, but research has shown that at 39 to 40 weeks, there is a healthy weight attained by the fetus or the soon to be born infants, and the organs are matured. There is less likely going to be health complications. And so there's a redefinition of what full term is. Now, the trimesters have with them various changes, and we're going to be talking about those changes. Let's see what those changes are. So, before running through those expected changes that occur within the trimesters, let's give a brief definition of those trimesters by their weeks. So, the first trimester is 0 through 13 weeks. The second trimester, 13 weeks through 28 weeks. And the third trimester, 28 through 40 weeks, which is the time for attainment of full term pregnancy. Okay, so let's talk about those changes in no particular order that occurred during first trimester. In the first trimester, the first thing or the first sign that alerts your attention of the possibility of being pregnant or that might trigger your visits to your care provider or the OBGYN that confirms your pregnancy is your missed period. This is typically the most obvious presentation. Now, in no particular order, if you experience your missed period, what are the other changes that could occur? So there's the changes within the breast tissue. There's a sensation of fullness or heaviness of the breast. There's also the experience of nausea and vomiting. Nausea is pretty common, very common occurrence. Vomiting, on the other hand, it is something that is varied in terms of its presentation within pregnancy, especially in the first pregnancy. However, caution here. For vomiting, when there is a marked experience of vomiting, we should alert the attention of our caregiver or the OBGYN. We want to rule out what we call hyperemesis gravidarum, which is a very serious case of vomiting within pregnancy. And you want to rule out conditions such as molar gestation, which is not a typical normal pregnancy, right? Now, those are in extreme cases, but if there's marked vomiting, there needs to for us to alert the attention of our primary caregiver or the OBGYN. What are the other changes? We've mentioned missed period, nausea, vomiting, breast tenderness. You have increased pelvic heaviness or fullness. This is as a result of increased blood flow to the pelvic organ or in preparation for the implantation of the embryo or fetus. So people might experience this as a little bit of pain or pressure within the pelvic area. There's also frequent urination during pregnancy, the first trimester in pregnancy, and this actually goes on throughout pregnancy. There's a feeling of changes in appetite. There's the experience of changes in appetite. In the first trimester, this is typically experienced as a loss in appetite, especially because of that sensation of nausea. But as the trimesters progress, this might actually evolve to an increase in appetite. So there's the changes in appetite. How about the skin changes? There, you might experience skin changes. There might be the sweaty sensation of the palms, especially within the first trimester, or other skin changes could be redness of the skin. It could be development of acne. The skin changes are typically perceivable as the pregnancy progresses. So it might be an occurrence in the first trimester, but as the trimesters progress, it becomes more marked. There's mood swings, this feeling of irritability, um, anxiety, so don't stress yourself too much or if you know someone, your um, partner is going through those mood swings, mood changes. Please be patient. This is only as a result. Um, it could be said to be as a result of the hormonal changes. So those mood changes are not atypical, and there could be feeling of faintiness, dizzy spells. So these are typically perceivable changes within the first trimester, and there could be more experiences. These are the common changes. Let's know about your experience within trimester, the first trimester, right? Let's. I would love to see on the comments what are your changes. What are those changes that happen to you? So more we can pull out more symptoms or more of those presentations within the first trimester. So let's talk about the second trimester. So what are those changes that occur within the second trimester of pregnancy? Now I must mention these changes are not abrupt. So you don't have a sudden cessation of a experience in the first trimester and a sudden evolution of another in the second trimester. No, it's more like a slow progression, right? So, what is present in the first trimester actually becomes maybe more marked in the second trimester, or it might be reduced in the second trimester and even further reduced in the third trimester or even more marked in the third trimester. So let's look at it that way. Now, for second trimester, one very obvious change is the resolution in the sensation of nausea and vomiting. And this is as a result of the decreased effect of the hormone beta HCG, the human chorionic gonadotropin produced by the placenta. So there seems to be that resolution or decreased sensation in the experience of nausea and vomiting. This experience, nausea and vomiting, can actually linger all through pregnancy, but it becomes reduced, right? And for some people, it actually resolves completely. Another symptom or perceivable change is the experience of bloating and even reflux and even constipation. Now, these experiences as a result of the hormone progesterone, which causes a relaxation of the gastrointestinal tract, right? These symptoms or changes are pretty much discomforting, right? And so there might be the need to alert the attention of the caregiver because there is remedy to help to alleviate this sensation. Another change is that of the skin. Now, there's what we call the mask of pregnancy, melasma, whereby the skin starts to become darkened, right? So there's that. There's also the darkening of the area around the nipples. There's what we call linea nigra, which is like a dark line extending from the pubic area to the belly button. Now, this actually fades, especially after childbirth, right? And for people, for different people have it appear in different ways. For some people, it's not so dark. For some people, it is very dark. Some people might just have that light streak, So it's very varied. There's also striae, what we call stretch marks, right? This is as a result of the hormone cortisol. There's a breakdown in collagen. Unfortunately, with the birth of the baby, it doesn't resolve. Most likely, it's going to linger. And for everyone, the people that don't experience this at all, it's very little stretch marks. Some people have it very prominent, right? So this is one. These are some skin changes that are apparent during the second trimester of pregnancy. Now, a very important change, a noticeable change by every pregnant woman, is the fetal movement. It is very crucial. Now, fetal movement actually it starts way in the first trimester. It's actually said to start about 8 weeks but it's not perceivable. So it becomes apparent or perceivable around 18 weeks for a non first timer of pregnancy. For the first timer, this starts about 20 weeks. You start to feel the fetal movement and it becomes more and more marked as the pregnancy progresses, right? Now, it's important because it's a time for the mom to actually participate actively in the well being of her fetus because she can tell by the movements my baby is growing healthy. Because when there's a decrease in sensation or perception of the movement, it calls for the attention. It might call for the attention of the caregiver. Typically, it's good to define what is your normal. Once you establish what that the pattern of the fetal movement is. So, for instance, you notice within a certain time movements, say what how often do you experience 10 times movement. So you start to count the fetal movements you experience in a day. And what is 10? What is your normal 10? How what's the duration of experiencing 10 times of fetal movements? So you want to establish that. And when you notice there's a decrease in that perception, there might be the need to alert your caregiver. Now, there might be certain things that or factors that might reduce movement, i.e., sleep. The fetus might just be sleeping, right? But then when it becomes very apparent, because the fetus is not going to sleep all the time, it becomes the need to alert your caregiver. So that's important. Another change is weight. The changes in weight. It is expected. Weight gain is pretty much expected during pregnancy. As the pregnancy progresses, there is that perceivable change in weight, and it actually tells about the fetal well-being. Is important because it indicates fetal growth. Right. Those are changes. There's weight gain, changes in weight gain. Um, there are other changes within the second trimester of pregnancy. Everyone has different experiences. So let me know what are those changes you perceived in the second trimester of your pregnancy. And then we'll talk about the changes in the third trimester of pregnancy. Now we enter the third trimester, the much anticipated trimester of pregnancy. Now, with the changes here, they're more like a progression of those experiences that occurred in the second trimester, and maybe at times even the first trimester. In the third trimester, they become more prominent or apparent, right? And with these changes, that could be evolution of other changes, right? So, for instance, we talk about the experience of bloating or reflux and even constipation. These might become more prominent, right? Especially if these were not addressed in the second trimester. There's also the skin changes that persist. The linea nigra extend, the striae become more prominent, the darkening of the skin become more apparent, right? These are changes that persist. Now there might also be the experiences of pruritus, that's itchiness, what we call pruritus of pregnancy. Typically, this could be normal. However, they still need to alert the caregiver about this development, right? To rule out other conditions that could present with pruritus. There's also changes of the appearance of varicose veins. There's cramps, muscular cramps, especially because of low calcium levels. There's swelling, especially around the ankle and feet, and even palmar swellings. This might precipitate what we call carpal tunnel syndrome. You start to feel pain around the thumb area because of the compression of certain nerves, like the median nerves, right? All because of swelling. Now, to sum it all, the peak of the third trimester is the evolution of the increase in frequency of what we call the Braxton Hicks contractions. The Braxton Hicks contractions actually start in the second trimester, right? At times they might not be so obvious, but in the third trimester they become more apparent and actually there's increased frequency. With the expectant mom, there's that anticipation of labor. And so these Braxton Hicks at times can confuse the expected mom for of a real case of labor, the onset of labor. However, how can you tell the onset of labor? The frequencies of those contractions become more. There's more frequency of contractions, and the contractions, the durations become shortened. Say, for instance, with labor, the frequency become increased. So have every 5-10 minutes, you're having a contraction, right? There's a space interval of 5 minutes between contractions, right? And also, when you experience these contractions, they last for at least 30 seconds, right? They could go up to 70 seconds. So the consistency in the contractions and decreased spacing between the contractions would pretty much um, give you an indication that, yeah, the true labor has started, right? So this is the onset of labor. For some women, there's what we call the water break. They experience what we call the water break, right? Or water burst. This is actually as a result of the membrane rupture. The amniotic membrane ruptures, and so we have the gushing of the amniotic fluid, but it looks like water, right? And this as well indicates the beginning of the labor process. So the labor process is about to start, right? So obviously, with the bursting of the water, the water break, there's the need to present to the health services in anticipation for labor. So this pretty much sums up what happens in the third trimester. Like I said, every person has a different experience, a unique experience, and it would be nice to learn more about those experiences you had during your third trimester. Maybe we all can learn from these experiences. Okay, so what else do we need to know about certain experiences within the trimesters of pregnancy? So now that you're aware of those changes that are likely to occur during the trimesters of pregnancy, what are those changes that should alert your attention and hence make you avail yourself to your care provider for further evaluation? Now, in the first trimester of pregnancy, one of such presentation or change is excessive vomiting. Now, vomiting is not unusual, especially in the first trimester of pregnancy. However, when it becomes excessive, there is a need for further evaluation. We want to rule out conditions such as molar gestation that can present with excessive vomiting, right? Now, there's some other conditions that could trigger excessive vomiting, especially cases of multiple gestation, right? So we have more than one fetus within the amniotic um, cavity or amniotic sac. However, we do not know, especially when it is not known why we're having these experiences. There's a need to avail yourself for further evaluation. Another is vaginal bleeding. At any point in pregnancy when this is an experience, there is the need to avail yourself to the caregiver for further evaluation. There are various causes of vaginal bleeding. We talked about um, the normal physiological expectation of um, bleeding that indicates a breakthrough bleeding when the embryo becomes implanted on the uterine lining. However, there are causes like ectopic pregnancy, abortion, that could actually present with vaginal bleeding. So we want to rule out these are the causes of vaginal bleeding. Then how about the condition of decreased fetal movement? This is another experience. If it's observed, there's a need to make yourself available for further evaluation, right? Especially during the second, third trimester, when it's very apparent you're able to establish the normal fetal movement. When that pattern becomes decreased, there's a decreased perception of those movements, there's a need for further evaluation. Now, there's symptoms of breathlessness, symptoms of um, palpitation, difficulty in breathing. This might indicate an ongoing cardiac condition that will cause the need for further evaluation. There's also changes in weight. Changes in weight is expected, especially increase in weight. Now, if there's a decrease in weight or no changes in weight at all as the pregnancy progresses, there's also need for evaluation. How about symptoms of confusion, headaches, lightheadedness? Very important. This could, as a matter of fact, indicate the presence of eclampsia or preeclampsia, and this definitely needs immediate intervention. So, need to be aware of such changes. Also, other changes that could be changes of or signs of depression, such as feeling of sadness, hopelessness, loss of interest, right? This might just be an indicator of depression that could progress or lead to postnatal depression, right? So there's also need to be aware of such changes and make yourself available for further evaluation. Now, these are perceivable changes during the course of pregnancy. There are timely visits that actually enable for evaluation, such as blood pressure monitoring, monitoring of blood glucose, um, presence or detection of protein in the urine, and hence assessment of the kidney function, also the liver function tests, and other hemodynamics that are generally assessed during pregnancy, right? And there are also special cases that might require aggressive monitoring, and you have to know what is your case. Is this a case of normal CISS, normal pregnancy? So this is not a case of advanced maternal age, especially in the first pregnancy, or hypertension in pregnancy, or hypertension of pregnancy, gestational hypertension, right? Or maybe a previous history of placenta previa, a placenta abruption, missed abortions, threatened abortions. These are conditions that might require aggressive um, monitoring, right? So you know your case, and definitely the your caregiver will best assess what your condition is, and the timely visits we must follow through, right? So let me know your story. Let me know your experiences. Is this your first time? Whatever your experience is, let us know, right? And I hope you found this talk informative, educative, and I do wish you a wonderful experience, especially if this is your first time. A good experience, whether it's your first time or it's not your first time. A wonderful pregnancy